results of these laboratories are professionals called medical technologists who perform and correlate results of complex laboratory tests on body fluids, tissues, and cells. Medical technology is a branch of medicine that deals with the different laboratory examinations to aid the physician in the diagnosis and treatment of disease. Inside the laboratory, medical technologists are being assigned in rotation in the different laboratory sections or departments. Clinical chemistry section help us determine the different chemical composition of the human body and blood, such as biochemical compounds, electrolytes, enzymes, and hormones. Hematology section. Medtechs engage in the cellular components of blood, such as RBC and WBC count, as well as hemoglobin and hematocrit determination by extracting blood from patients. Microbiology section allows the medtech to cultivate, isolate, and identify the different bacteria, fungi, and viruses. Clinical microscopy section enables detection of diseases involving urine, feces, sperm cells, and different body fluids. Histopathology section focuses on the technical processes and assists the pathologist in preparing biopsy and tissue slides, which will aid in the physician in determining the extent of a certain tumor inside the human body. Immunology and serology deals in the basic principle of antigen and antibody reactions, identifying antibodies, investigating problems with the immune system like autoimmune and immunodeficiency disorders. Immunohematology section is focused majority on identifying the major blood groups like the common blood type A, B, AB, and O. In this section, all donated blood is also being tested for contagious diseases and performs cross-matching procedure to ensure the safety of blood prior to the transfusion. Molecular laboratory. In this section, medtechs perform the processes of replication, transcription, and translation of genetic material. This section also takes charge for the nasopharyngeal and oropharyngeal swabs to confirm COVID-19 infection utilizing RT-PCR. In order to practice and become a registered medical technologist in the Philippines, he or she must complete a 4-year course leading to the degree of Bachelor of Science in Medical Laboratory Science or Bachelor of Science in Medical Technology in any CHED-accredited medical technology schools and must pass the licensure examination for medical technologists conducted by Professional Regulation Commission or PRC. A duly registered medical technologist should also register himself or herself as a member of the Philippine Association of Medical Technologists or PAMET, which is the only recognized professional organization of medical technologists. Aside from the mentioned job opportunities in a typical laboratory hospital, a medical technologist can also one of the following. Medical technologists' salary may vary depending on the institutions, length of service, and postgraduate trainings. For private hospitals or companies, for public or government-operated institutions, while most experienced medtechs have higher salary grade. In emergency of health crisis such as the COVID-19 pandemic, the medical technologist will always serve as the medical frontliners in service to God and humanity.